Greetings, my friends. I'm Dr. Supratik Bhattacharyya. I'm a consultant endocrinologist based at Kolkata. And today I had been debating about what should be the first line of treatment for type 2 diabetic patients. And I was speaking in favor of SGLT2 inhibitors. So, with the newer evidences in place and the newer guidelines that are coming up from ADA, EASD, ACE, as well as EAC, we know that there is a changing concept regarding what needs to be used ahead of metformin if needed in a special cohort of patients who has got comorbidities. For example, anyone with a background of heart failure or CKD should be given SGLT2 inhibitors ahead of other molecules like even metformin. So, in spite of using SGLT2 inhibitors, if they cannot reach their glycemic goal, then only you bring on board a molecule like metformin or other anti-glycemic agents if needed. So, the point remains that one shoe doesn't fit all, and we need to customize our treatment based on the need of the individual. And SGLT2 inhibitors has got multiple pleiotropic benefits. So, it not only benefits in terms of giving protection to the heart as well as the kidney, but at the same time it is beneficial in terms of bringing down the systolic blood pressure by 4 millimeter mercury or the diastolic by 2 millimeter mercury over on top of the standard of care. Similarly, we know that it has started finding its benefits in terms of treatment of NASH. There is a reversal of NASH score, and the newer avenues to treat NASH is being explored, and SGLT2 inhibitors seems to be promising in that regard as well. When it comes to sleep apnea, again SGLT2 inhibitors are showing promises, and probably this is finding its use in treatment of sleep apnea because of the mechanistic benefits that come with it. We know that SGLT2 inhibitors are very relevant when it comes to the Indian phenotype, because we carry a lot more fat around the waist or the visceral fat, which is addressed by the SGLT2 inhibitors, and thus not only it reduces the inflammation, it also causes natriuresis and glycosuria, which means that a person is losing calories. So, in an obese or overweight individual, we know that there is benefits in terms of weight reduction and also in terms of addressing the visceral fat. Because of natriuresis, we get benefits in terms of reduction of the blood pressure and also kidney benefit as well. There is a lot of crosstalk between the heart and the kidney, and there are common pathways that lead on to which can affect both the heart as well as the kidney, and these are addressed by the SGLT2 inhibitors. So, gradually we are moving in a new direction where we are taking on the evidences that are coming in from the various RCTs or the real world studies and using that in our clinical practice. So, metformin just as a blanket therapy, blanket first line therapy does not stay anymore. So, we need to individualize or customize the treatment based on the need of the individual, and SGLT2 inhibitors seems to be very promising in this regard.